Bismillahirrahmanirrahim. In this video, the elastic fiber and elastin are described. Elastin and elastic fibers are the member of extracellular matrix protein that are secreted. They are synthesized by fibroblast in skin and ligaments. They are synthesized by smooth muscle cells in the blood vessels or chondrocytes in elastic cartilage. They are distinct because they are the type of the extracellular protein that is non-glycosylated, and they provide elasticity and recoil to the tissue. They are present in skin, uterus, ligaments, lung, elastic cartilage and aorta, and due to presence of extreme hydrophobicity and cross-linking, they are extremely insoluble. Their key structural properties are highly hydrophobic core and extensive covalent cross-linking via lysyl oxidase. They are very slowly turned over once they are polymerized. The enzyme resistance for these elastins, they are resistant to most of the proteolytic enzyme. They degenerate with age, and their reduced replacement lead to wrinkling and skin atrophy. Ultraviolet rays effect they promote ultraviolet rays promote abnormal elastotic material accumulation that result in coarse wrinkling and thickening of the skin. And this elastin pathologies, one is important one, that is emphysema due to alveolar elastin loss or laxity of the skin due to aging. The repair capacity of this elastin and elastic fibers is limited in skin and lung, and but the arteries can regenerate elastic lamellae after injury. Poor elastin repair contributes to chronic condition and aging signs. Precursor to the elastin is tropoelastin. This tropoelastin is a soluble monomer that is produced inside the cell, and it is secreted into the extracellular space where it binds with the fibrillin microfibrils that serves as a scaffold for this elastin, and then lysyl oxidase cross react it to the to form insoluble mature elastin. There is presence of cross-linking also. Desmosine and isodesmosine bonds are uh, are used for these cross-linking, and these specific unique cross-links give elastins its stretch and recoil properties. Unlike collagen, this elastin is not constantly remodeled. It is produced mostly during fetal development and early childhood, that then it remains for life. Damage is hard to repair, hence with aging there is appearance of wrinkles. Many pathologies are associated with this. We just discussed that emphysema is one of these, and there is degradation of alveolar elastin. Marfan syndrome is due to abnormal fibrillin. This fibrillin is actually serves as a scaffold for, or these fibrillin microfibrils. They serve as a scaffold for this elastin fibrin. Then cutis lexa, when there is fibrillin mutation, there is development of lax skin, that is cutis lexa. So arteries can regenerate elastic lamellae even after hypertension or bypass grafting, while in the skin and lung, the regeneration of elastin is poor. So elastin loss or mutation affect tissue elasticity, vascular integrity, lung function, and aging. This picture is summarizing the uh, elastin. Elastin is produced from a single gene. This monomer is produced a single gene, but there are various splice variants that are present. That is due to splicing of mRNA fragment into different elastin proteins. So the elastin monomer, that is tropoelastin, it polymerize or cross-link to form elastic fiber. This cross-linking involves lysine-derived residues, resulting in desmosine and isodesmosine bond, which give elastin its strength and recoil tendency. These monomers, elastin monomers, can self-associate into amorphous cross-linked fiber also. The elastin assembly requires a scaffold that is made of microfibrillar polymers mainly composed of fibrillin 1. These microfibril guide the deposition and alignment of the elastin monomer. So here this is showing the dark core and outer structure. The dark core is showing the amorphous elastin, while the outer structure, it is organized microfibrillar sheath that is giving stability and organization. So this elastin is a highly extensible protein that form fibers by cross-linking into an amorphous core. This is guided by microfibril, making it essential for the elastic tissue to maintain shape after stretching. Here the characteristics of fibrillin are summarized. So these fibrillin are critical component of elastic fiber formation in connective tissue. Fibrillin are described as large glycoproteins, and they are most common microfibrils that are involved in the assembly of elastin fiber. Fibrillin, they form a scaffold that elastin monomer used to align and assemble correctly. Fibrillin self-assemble into a beaded polymer, and here you can see that is a wavy line that is depicting this fibrillin, and it is polymerizing into a beaded polymer. This beaded appearance is a hallmark of fibrillin microfibril seen under microscope. Other microfibrillar component that interact with the fibrillin and regulate the elastic fiber formation are LTBPs, that is latent transforming growth factor beta binding protein, fibrillins, amylin, MAGPs, that is microfibril associated glycoprotein 1 and 2, lysyl oxidases that are involved in cross-linking of these fibrillins. So fibrillin is not elastin, but without fibrillin, elastin cannot assemble properly, and mutation in fibrillin 1 causes Marfan syndrome due to defective elastic tissue in the vessels, lungs, and ligaments. Thank you for watching this video. If you have any query, please write in the comment box.